welcome to 2023. Happy New Year to all my subscribers and all my returning viewers. Thank you for stopping by. I really appreciate you. This year we are going to do a whole lot of videos about nursing school, so make sure you subscribe to this channel. My name is Nurse Dorian and this is Unique Nursing Lectures YouTube channel. If you are joining us for the first time, kindly hit the subscribe button and turn on the notification bell so you get notified whenever we post a new video. In this video I want to talk about how students get dismissed from nursing school and why. Okay, a lot of students ask me this question: is it true that after my first 6 months, if I don't do well, I'll be sent home? Yes, it's true, but you will not just be sent home immediately. You'll be given a second opportunity for you to rewrite the papers or the courses you failed. For example, if you fail anatomy and sociology, that is 2, you have to pay money for those 2 courses and rewrite that course again in 1 week or less, in 1 week maximum. Okay, some school is 2 weeks, for some school is 1 week. Okay, they won't give enough time for you to prepare again for these receipt exams, and the disadvantage is that the receipt exam is always very difficult compared to the first exams that you write. Okay, so it's always good that you try your best to see how you can clear your paper in the first sitting, so that when others are struggling with their preparing for receipt, you'll be traveling home to rest. Isn't that amazing? So it's good that you do something good at that first time, because what is coming next, it will be an elimination exam, because they know they want to reduce the number of students, so they will make the question tough for many students to answer. Why students get dismissed? If you before you enter nursing, or once you enter nursing, try to study the grade, how they used to pass students in school of nursing. In the school of nursing I went to, 50 was the pass mark. That is the minimum number they can take. 50 was the pass mark, and that is what is still obtainable till today. If you want to be promoted in any course, you have to score at least 50% in that particular course. Okay, you can do more than that, but the minimum is 50. Okay, if you can score 50 in all your courses, you don't have any problem. You'll be promoted to the next level, to the next class, so you will not be eliminated, and then you enjoy your stay in nursing school. But as time goes on, make sure you improve on your score, work on getting 60, 70 and the rest, because you really need to pass exams. But if you fail, like you score other courses 70, 65, and then you have 145 or 49.5, you will be sent home because of that 0.5% that you lose. Okay, so that is how it is. You have to prepare well. It's quite amazing that almost all students, in fact everybody reads, but it's only few that pass exams. Why? Is it because they don't understand what they are reading, or is it because they are anxious inside the exam hall? Maybe one of the two, but most students don't understand what they are reading. What they have in mind is what I call illusion of competence. They only know the definition, they know a few things, so they just believe that if they see that question in the exams, they'll be able to answer. No, it's not true. They will not ask you a straightforward question: what is anatomy? Mention the 3 body parts. No, they won't ask you all those things. They will ask you question. They will make that question a little bit difficult for you to understand. You have to read the question first and understand before you answer them. Okay, most of their questions are discuss. You rarely see state or highlight. Okay, so for you to write discuss and get the full mark, my dear, you have to explain and explain and explain again. And another thing is that some students do skip question in exams they don't understand, or question they have no idea about. For example, if they know question 1, 2, 3, 4, then question 5 they don't know the answer, they haven't heard of anything related to that question, they will just leave that space blank. No, don't do that. In nursing, you attempt all questions. Don't leave any space untouched. Make sure you write something. Okay, if you don't write something there, you will lose the whole mark. But if you just try to write something, maybe it might not be something exactly what you are asked, but let it be related to the question. Okay, maybe from definition, if you can know the definition of any question or of a term, you can now use that to explain further, and then expand it. Use your own knowledge, paraphrase, write whatever you know. Make sure you fill the blank space. That's what we do most times, because you can't remember exactly what you read during your preparation time in the exam hall. But make sure you write something. Don't leave your paper, don't submit your paper blank. It is not good. You might even lose mark as a result of that, because they will just believe that you don't have this this critical thinking ability, to be able to solve difficult questions. Okay, if you are not prepared for it. So always try to prepare ahead. Read wide. Make sure you understand what you are reading. Is very important. It's not about reading many books, complicating things for yourself. Make sure you understand, because if you don't understand, how are you going to reproduce what you are reading in exam hall? Because it is your result that will reflect if you are actually if you were reading actually, or you were just glancing at each page, to see the pictures. So it's better you sit down and read. Whatever you don't understand, take it to your senior colleague, browse online, check YouTube. There are so many places you can check things, and then you still figure out what that thing is. So make sure you stay prepared. Many students also sent home after their second trial. If you fail receipt, you are going on no other alternative. But you failing doesn't mean that you are too weak or you are not intelligent. No, it's not true. Some students that I witnessed that left School of Nursing in their first year went to write JAMB and got admitted into university, and they are doing quite well. It's just that in nursing they need the best, so they always make it survival of the fittest. Okay, so make sure you stay on top of your game, prepare on time, and stick to your timetable. Read as much as you can. Don't leave any question untouched. So thank you guys. This is where I'm going to stop in this video. If you haven't subscribed, please hit the subscribe button. The next video is coming soon, so see you then.